What's up, everybody? You got low back pain? Is it causing you to lose sleep at night? Having trouble chasing your kids around? Are you skipping workouts at the gym because your back just hurts a little too much? The good news is you're not alone. 80% of people in America will at some point in their life have some low back pain. I'm Jake Schaake, Doctor of Chiropractic here at Back Pain Center, and today we're going to talk about 3 common causes of low back pain. The first and most common is just a typical muscle strain. The low back muscles basically stretch from one joint all the way up to another, usually spanning multiple joints at the same time. Muscles allow for all motions of movement, so flexion, extension, bending both ways, rotating both ways. And just as a result of a twisting or a bending movement, whenever it's under a high load that we're not used to, or we've become deconditioned because it's wintertime and we've sat inside all winter, and then we go out to do 3 hours of yard work, it can sometimes do it for us. Most people don't remember a specific incident, but some might. Symptoms for a muscle strain are going to just be point tenderness in the low back, decreased ranges of motion, muscle spasms, and maybe even a little bit of swelling. The next common cause that we have for low back pain is coming from the disc. A disc herniation, a slipped disc, a blown disc, a disc is out of place, whatever you've heard it called. The disc is just the squishy material in between the vertebra that allows a little bit of cushion and allows your joints to move in kind of all ranges of motion. It's typically, most commonly, chiropractors see this as a result of a flexion type of injury. Somebody bent forward, felt their low back, and now they can't bend forward to tie their shoes. Most of the time that can be easily treated in office and will respond in just a few days. The good news is a disc injury will heal all by itself, even without a chiropractor. But a chiropractor can help it expedite the whole process and give you some tools to be able to keep that away and not kind of relive the same pain 6 months down the road. So typically what a chiropractor is going to do is, if the person hurt their back bending forward, we're going to go the opposite way. So McKenzie method, or mechanical diagnosis and therapy, we're going to just do some repetitive end range loading. And what we can start to see then is if the patient responds, that being a reduction in pain, centralization in pain, sensation symptoms start to come back, muscle strength starts to come back. If we can see some of that in office, that's a good indication for us that surgery is not needed. And we all know that everybody's trying to avoid that surgery. Symptoms for the disc can often include burning, numbness, tingling, radiation of pain into the leg or lower extremity, even further down into the foot, muscle weakness, and decreased range of motion. The last common cause of injury we're going to talk about is very common in the youth athlete, more so than the adult athlete. But nevertheless, it can happen to anybody. The third one is called a pars fracture, or a spondylolysis. Basically, it is a stress fracture of a certain part of your vertebra, which is somewhat weak. Usually this is a repetitive type of loading injury. A stress fracture of the pars is most likely seen at L5, and it's often asymptomatic, but can always be seen on imaging. It has a high increased risk in sports like gymnastics, weightlifting, CrossFit, football, diving, swimming, wrestling. It can be seen in all sports, or even in just your regular everyday life, but are most common in those sports that I mentioned. Basically what happens here is repeated extension, or extension with a little bit of rotation. Often seen in those sports, can cause just some undue stress on that part of the vertebra. Eventually, stress fracture happens. And then as clinicians, we need to be able to recognize that, stabilize this area, help the patient heal just with some good old-fashioned rest, stabilization, and then we'll look to mobilize the segments above and below. So, pars fracture, your third common cause. We only listed 3 common causes of low back pain today. There's many others. If you're feeling like you got some low back pain, call the office, 636-978-5511, or visit us at backpaincenter.us. Make an appointment today. I'll help you out. Let's get you back on your feet so you're sleeping again, chasing your kids, and you can get back to the gym to work out like you like to. See you next time.